and welcome to Perito Talk, our occasional conversation with men and women who matter. This evening, we have with us Dr. Sudha Seshayyan, a one-time anatomy professor, currently the Vice-Chancellor of the Dr. MGR Medical University, and a very, very well-known face in the Tamil literary circuit. Welcome, Dr. Sudha.
Thank you.
We will have this conversation with Dr. Sudha Seshayyan in two parts. In part one, we will try to talk with her about medical care, health care as it stands today and as it will stand tomorrow. In part two, we will speak to her about medical education, about the frontiers of education and how health education ought to be in the future. My first question to you has to do with how affordable healthcare today is. The popular perception is that healthcare is expensive. What would you like to say about that?
In the sense, affordability has been increasing. Compared to what it was a few years ago, healthcare is becoming more and more affordable. And given the circumstances, I feel it will become even more less expensive in the next few years to come. Why has healthcare become better affordable now? There were times when some procedures, some kind of treatment was considered high funda, and that could be given only in certain centers. Certain centers which were either in the cities or the so-called tertiary care centers, which are a kind of high funda, larger establishments. But today we find many of these procedures can be done, treatment can be given even in smaller centers. So people don't have to travel, stay in a larger city, all that added to the expense. Now all that is getting cut. Especially during COVID times, we were able to find people could remain in their places and still get a good treatment. And many centers are coming up. Many smaller centers are trying to catch up and offer good treatment. Technology has helped. Instead of a long drawn surgical procedure, today things can be done in a small procedure, non-invasive procedure, which will just take about 20 minutes, 30 minutes time. Say, for example, those days, if there was a kind of a hemorrhage in one of the vessels in the brain, the treatment was prolonged. The treatment had to be given immediately, like people had to be rushed to larger centers. But today you have some kind of radiological procedure, interventional radiology, where coiling can be done in about 15 minutes time. So in a smaller center with ultrasound guidance or radiological guidance, the same treatment can be given and the person can be saved. So what now happens is they don't have to travel much. Of course, even now, certain procedures are a little expensive, but I expect these expenses to come down as technology takes over, as more centers come up in different towns. Now you don't have a kind of a completely rural, completely urban setup. There are mid-level centers. Even in a place like Vellore or Salem, as you move, you find there are mid-level centers which can give the initial treatment or the required treatment. And then if necessary, which will only be about 5 to 10%, the patient needs to move to a larger center. So that way, affordability has become better.
Just to take off from there, you raised this point about technology. I'm sure technology has been coming across the last 50 years in different manners. Today, yes, in hindsight, they might look very small, but over pockets of time, technology has come in. But has this not actually gone ahead and done two things? One, escalated the cost for the right reason and also escalated cost for the wrong reason. Let me be a little frank here. Doctors also have to earn return on investment. So has it also led to, I'll paraphrase that and let me say, has it also led to defensive treatment?
Yes, sometimes it has led to defensive treatment. I thought we'll come to this aspect of it because this part of it will cover your first question and the second question. So let's reserve that part of the answer. I'll come back to it. But
Okay.
coming to technology, technology has taken over medical treatment, healthcare sector, and what is expected is technology will advance further. But that will be for the sake of a better direction, in the sense, certain procedures which we were not able to do at all, we are able to do now with technology. Virtual reality, augmented reality, all these have helped better surgical acumen. What a surgeon was not able to see, whatever life he's not able to see, with VR, he'll be able to visualize. So smaller procedures are being done, accurate procedures. Now, these accurate procedures will save the post-operative time that a patient has to stay in the hospital, avoid post-operative complications. So in the long run, these technological advances will help. And certain treatments which just could not be imagined. Could you ever think of a stroke patient getting back to normal life? Could you ever think of a person with heart attack? I remember 40 years ago, people used to resign their jobs because they had one attack. Like today, things have changed. We need not have even bypass, but then there are stenting procedures and other procedures. So these are all technological advancements which have helped the health sector. But on the other side, when you have massive absolute numbers, it appears sometimes that the contribution of technology had not been that much, or the proportion that we anticipate. Now, coming to the other side of your question, yes, defensive treatment has increased, and also sometimes the expense has gone up for the wrong reason. But the answer to this will be not cutting technology or not trying to do the other thing. We'll have to probably increase the awareness amongst people. There could be lifestyle changes which need to be advocated.
I will ask one more thing that is related to this. My question may not be at the leading edge, but it's a matter of concern to many people. Let us say I go and get a pathological report done. There are multiple tests that a doctor wants me to do. I do it. I have the test done, the doctor sees it, and then I am asked to see a different doctor. I'll not name the place, but let's say I'm asked to see a different doctor. I go to that doctor who operates in a different place, in a different city, different hospital. He wants me to perform the same test because he says, I trust my center better. Is it not possible for the government to lay down or standardize, saying these are centers that are acceptable? If these centers, these tests have been done, take it, don't load on to the cost again.
That's a good idea. And I think that's already on the cards. Yes, we were on a transition time when all these tests came up. Probably the last 3 decades, many number of tests. And I do agree, people are very choosy sometimes and say, yes, I want the test to be done only in this center. But probably for obvious reasons. But in the next 1 decade or so, things will change and we will standardize. Okay, if this is there, fine. See, one of the reasons why there was some kind of a mistrust on some of the centers performing the test is, we still are not sure of the test itself. These have just come up and only now we are getting standardized. So this probably is the standardization time. And 50 years of standardization in a large span of history is acceptable. So probably in the next one decade's time, we can anticipate all that you say. There will be standardization. Even now it has started. Even now in the radiological centers, it has started. Maybe in slightly higher specialty areas, it will come up in the next near future.
Just one other quick question, because we are talking about technology. Today, there is so much of talk about robots, AI, and from what I read, the first place where these will happen is in healthcare. Yes. While they will happen in factory, but more likely, their greater work will happen in healthcare. How much do I trust them? I see a doctor. Okay, that's one thing. I see a machine going to perform. Let me change that and say, how is it going to change the landscape of the way that you people will treat?
Robotics and AI have already come in. That's why I told you, robotics is offering a better scope for the surgeon to perform, better scope for any intervention being done. So the doctor is also able to perform better. That is one. Second, with the robo and AI coming in, the quality time that is required would be reduced, in the sense, I don't have to spend that much of time with a patient. Say, for example, I'll put it in very simpler terms. I do a procedure. I open up and do a procedure. Okay. I put in the robo or the robotic arm. The robotic arm performs it. I come out of the incision. Now I need to suture the incision. Everyone knows suturing is done. No, I don't have to do it. I can trust the robotic arm to do it, which means that time is saved, and I could spend that time, quality time, on some other patient. I'll be able to converse better. I'll be able to spend more time. This is what we anticipate. This is what is being anticipated with the robotics and AI coming up, that quality time could be spent with patients better.
Now I think you have hit the nail on the dot, because that was the next question that I actually wanted to ask you. I have a lot of respect for the medical profession. There can be two views on that. But I also see that doctors actually don't talk to patients. Now you're saying don't talk to patients the way a patient would want to be talked, especially if he does more superior work. You're now saying that this will give him more time to speak to patients. Will it give him more time to speak to patients, or will it give him more time to go and do another surgery?
No. Yes. Theoretically speaking, it's a win-win. He can spend that time on doing another surgery. But I think things are changing. We are about to talk about the medical education sector a little later. Things are changing. And one other issue, now that you have raised up this issue, we would have to think that way also. You talked about defensive practice, defensive medicine, right? Why did it come up? Plainly because medicine became a kind of a consumerism. And everyone is scared. Everyone is scared. Even the doctor is scared, because tomorrow, if there are questions on the way the doctor gives a treatment, he would have to defend himself. So documentation becomes important. And all that led to what is called defensive medicine. The same thing happens on the other side. When I want to communicate with all media and knowledge explosion, the patient also comes with certain demands. Fine, this is a disease. I tell them, this is a disease which affects this part of the body. No, doctor, I read it, and this is a disease which affects only this part of the body. So this is a kind of a balance that we need to set. It is not only the doctor who will have to balance himself, it is everyone. Probably we'll land up in a situation. I'm not trying to be very realistic, or I'm not trying to be defensive of the medical profession, but all of us, people, including the doctors and the patients, will have to evolve to that stage where we try and strike a balance as to accept the thing from the scientific perspective.
I completely agree with you. In fact, I can even relate that to you. I'll share a very personal experience. I actually went to my doctor. I told him this, and this is what I'm experiencing. Therefore, this is the thing that needs to be done. Now tell me what. He told me, please tell me who is the doctor and who is the CA. I said, oh no, you're the doctor. Then he did something and then said, you're perfectly all right. And the moment he said you're perfectly all right, everything disappeared. So that in one way, that is also good if you have great trust in the doctor. I appreciate that. My last question in the first part. In the second part, ladies and gentlemen, we'll talk about with Dr. Sudha Seshayyan about the medical education. To come close to the first part, I would want to know from you, Dr. Sudha, as to what is the kind of improvement that is required in healthcare at the first point of contact, maybe at the primary health center level, I understand, I do not know how far I am right. I understand that abroad, people's first choice is go to what in India we call public hospitals, that means to government hospitals. Only later that they go to private hospitals, is what I understand. In our countries, it's so very different. It's so very different. So, what is it that you think one needs to do at the first level of healthcare?
There were lots of hiccups at the primary healthcare level in the last few years, or maybe 20-30 years. But as I see it today, things are changing. Today, the perspective of the common man is, yes, I'm prepared to accept what the public sector hospital gives, and they've seen it with their eyes. So slowly, the thrust is towards the public sector institutions. That is one. Second thing, in a country of our proportions where trauma care is required, somebody gets hit on the road and something happens, trauma care is better served now with lots of networking amidst hospitals. So that is improving our, primary contact with the patient. So these things will have to be emphasized upon, I think, that kind of a nexus, and making people understand that the golden hour is important. Whatever, either it is heart attack or it is injury, whatever, the golden hour is important. Don't waste time. Try and help get the person moved to the nearest hospital. That kind of awareness will have to be created. So the awareness amongst the common public, awareness amongst the medical professional. Don't waste time on formalities when a patient comes to you. It is that you'll have to save the patient and then probably think of the formalities side by side or a little later. So this kind of an education on either side will have to happen. And coming to the primary health care point, this is where I said we have to increase awareness. We have to change our lifestyle. I'll give you one or two examples. We are a tropical country. And in a tropical country like ours, we have today come to a situation where we are prescribing vitamin D supplements. Primarily because our lifestyle is completely changed. People do not even step out of the AC hall or the AC room, and absolutely no sunshine on them. Now, who is responsible for this? For such a situation, who is responsible? I would not blame one single individual. I would only say, yes, the medical sector will have to educate people. People should be prepared to get educated. So it now becomes a collective common responsibility that we look into certain things of this kind. All these will impinge our health sector in the next 2 decades or 3 decades. I don't want to see a generation which does not have vitamin D at all and will have to depend on supplements forever. Not in a country like us. So we would probably have to harness our natural energy. That part of it has been forgotten. And that could be done only by collective responsibility and not by one sector or by any kind of a blame game. Several lifestyles. We have forgotten that we could sit on the floor. And that is leading to a lot of arthritic problems. Yes. Why should we waste our natural way of life or natural resource? So these things will have to be taught, maybe right from the school level. Slowly we will have to educate people, talk to them about this, slowly bring back good habits. And that is what is wellness. Wellness is something wherein you bring in good habits, kind of, bring it into practical life. So from health, we'll have to move to wellness, and wellness is a collective responsibility.
I think that is very well said. Ladies and gentlemen, we'll close out part one. I'll very quickly summarize the key points that Dr. Sudha Seshayyan said. She said that we are for sure moving towards affordable healthcare. She said that the integration of technology with medical care will bring about substantial improvements in terms not only of the kind of development and medicines that you see, also in terms of the kind of quality time that the doctor will be able to spend with you. But I think what I liked most and what should be the principal takeaway for all of us is that there is a lot in our past, there is a lot in our history, there's a lot in the environment around us which we must take cognizance of, and that therefore being well is far more important than being healthy that arises out of going to a hospital. Thank you very much, Dr. Sudha Seshayyan. In part 2, we'll talk about education.